All right, let's go to the next article. I'm going to throw this one over to you, Ashley. The Lipson Koffler Myopia Management Treatment Protocol. I interviewed Lipson and Koffler on the podcast about this treatment protocol, and I heard their lecture at Vision by Design. Um, what, like, okay, so give us a rough overview of what the article is about, and then let's discuss it.
Yeah, so what they're trying to accomplish here is a very streamlined approach to evaluating risk and then taking that risk and then making a protocol specifically for each level of risk. Like this was very well thought out. I think it's a very approachable way for maybe new practitioners or someone looking to streamline how to implement myopia management into their practice. So this is a two-part article. The one that we published this year, I think it was the second one was published this year. I'm not really sure when the first one was. Excuse me for not knowing, but you need to reference the first one for the second one to make sense. So I'll kind of
Right.
summarize the first one. So the first one looks at how to evaluate risk. So there are 7 attributes, and I'll list those attributes: ethnicity, gender, age of myopia, onset, parental myopia, time outdoors per week, time spent on near work. And then if you have an axial length or a biometer, you can either apply your risk factor to a 7 attribute table or a 6 attribute table if you do not have axial length. So once you look at each one of these risk factors, so let's say ethnicity, for example, you score each risk factor. So if the patient is Asian, they get a score of 4. If they're African American, they get a score of 2. And you go through each one of those attributes and you tally up the total. And based on that total, that will give you whether or not the patient is at lower risk for myopia progression or very high risk. There's a whole scale there. So once you have figured out their level of risk, you can apply that to the protocol. And the protocol literally has a line by line recommendation for what you should do based on their level of risk. So it even starts with pre-myopia and it goes all the way to very high risk. So, it's thorough, it is easy to understand. It really helps with that question of, well, what do I do with this patient that may only have one parent with myopia, or this patient that has 0 parents with myopia versus this patient that has 2 myopic parents or of Asian descent, because all myopia management isn't necessarily equal. We kind of like to package it that way, that we should be super aggressive for every single myope that comes into our practice. So this gives me a little sigh of relief that I don't necessarily need to treat every myope the same.
Right.
So this is a good read. So for anybody that would like a streamlined approach to evaluating risk and then applying that to a protocol, take a look at this article for sure.
Yeah, yeah, and it definitely has application for every level of practitioner. I've been paying attention to the AOMC Google group. They've been talking about the protocol on there, and even like established fitters who I've known for years are using the protocol and giving Michael and Bruce feedback on it. When I interviewed them about it, like they mentioned that this kind of treatment protocol exists in all other healthcare. If there's a risk assessment profile for everything
Yeah.
practically, and why we haven't had one for myopia management. It's kind of insane that we've gotten to this point and not had something like this. Kevin, do you think that this helps with that conversation with parents, right? Because you can, you're the expert, you're trying to position myopia management, you're trying to communicate the risk factors, and then you have something that you can actually show the parent as a result, because the treatment protocol isn't just for practitioners, it's also intended for the parents of the patient.
Yeah, so what I like about this article, and also their approach is, just like Ashley said, it make it very simplified and a very toned down approach for parent to understand. I think sometimes we are going to the rabbit hole as a clinician. We know so much about the science, know about the nuances, but we forgot how to take a step back and be able to kind of make them more digestible for parent. I think what this does is to make it more visual, we can present the table and the chart, and oh, this is a score that your kids is showing that. I think that will actually be more understandable and be able to convey the message a little easier and more effectively.
Yeah, whatever we can use to help bolster the confidence of the myopia management doc, I think is going to be super helpful for
I
sure.
also think it creates a safety net and a reassurance that what we're doing is enough. Like sometimes we question, like, oh my gosh, am I being aggressive enough, or am I? What options are best for these types of patients? I could get that kind of question all the time, and it's just good to have something in writing, something that is backed in experience and just a lot of really solid knowledge.
If you're interested in getting the rest of the episode, consider becoming a paid supporter of the Myopia Mindset. In addition to an extended version of this episode and every other episode that we do, you'll also get access to exclusive monthly bonus episodes of the Myopia Mindset. And I know you're interested. You've made it this far. You can do so on our Substack, myopiamindset.substack.com. I'll see you at the next one.